Hello, everyone, and welcome to Fall Prevention Tips Part 1. My name is Autumn Santos, and I am the Doctor of Occupational Therapy intern. Let's begin. So, footwear is essential in preventing falls. So, what I have here is a list of all the things that I feel is necessary to wear to prevent those falls from happening. So, let's go in order. So, sturdy soles. Choose shoes with sturdy, non slip soles to provide traction and stability on various surfaces. Low heels. Ladies, I know we may not want to hear this, but opt for shoes with low or no heels to maintain balance and preventing tripping from happening. Having a secure fit. Ensure shoes fit properly and securely to prevent slipping or sliding within the shoe. Having a closed toed design. Select shoes with closed toed designs to protect feet and prevent injuries from stubbing or bumping toes. And I know this can be challenging when we approach the hotter months. However, if we want to prevent some of those injuries, just think in the back of your mind, having a closed toed shoes is more appropriate than having an open one. So, having more of a supportive structure, look for shoes with supportive arches and cushioning to provide comfort and reduce strain on the feet and ankles. Having adjustable straps or laces. Consider shoes with adjustable straps or laces to customize the fit and accommodate swelling or changes in the foot size. Lightweight materials, choosing these can minimize fatigue and make walking a lot easier, especially for those with mobility issues. Waterproof options. Opt for waterproof or water resistant shoes to maintain traction and stability in wet or slippery conditions. This also is key when we're choosing house shoes as well. I know we want to go for more of like the cozy, cute, fun slippers, but for these type of options, it's important, especially when we're going into the bathroom where it's a hot spot for falls. So consider orthopedic options, explore orthopedic or therapeutic shoes designed specifically for seniors with foot conditions or mobility challenges. You can also do regular inspections. So, this can include looking for signs of wear and tear, such as worn out soles or loose stitching, and replace them as needed to maintain safety and support. I know I do that all the time with my shoes. And I want to mention if you are someone who's very, very active, I run a lot. So, when you're running, you're causing the shoe to wear down more. So, having even more occasional inspections are also key for this situation. So, for the home assessment, this is also going to be key in preventing falls. So, there's a bunch of things that you need to evaluate to ensure that you're not going to slip, trip, or fall. Granted, accidents happen, but we're trying to try our very best to not have these happen in our sanctuary of our home. So, we want to evaluate flooring. So, you want to check for uneven surfaces, loose rugs, or slippery areas that could pose tripping hazards. Say, for instance, you have a loose rug around, you can also buy adhesive tape that you could put on the back of the rug, causing it to stay in place and not slip out from underneath you, which is good. You want to assess lighting. So, you want to ensure that there's adequate lighting all throughout the house, especially staircases and hallways. Again, it's important to have these because staircases are crucial and hotspots for falls when we're trying to, if we're in a hurry going up and down the stairs, and then you may just slip on, especially if you had carpeted stairs, you just slip on the stairs. So, using the hand railing, making sure that the whole area is decluttered is essential for safely getting up and down those stairs. So, again, you want to examine having a sturdy handrail, having even steps to facilitate a safe navigation. So, reviewing the bathroom for safety. So, assess bathroom features such as grab bars if you have them. If you don't, consider them because they're able to, prevent that slipping and tripping from happening when you're grabbing onto a stable surface and getting into the shower. They're extremely helpful. Also, non slip mats are important and shower benches to enhance stability and prevent those falls from happening. Consider bedroom accessibility. So, it's very important we don't think about it, but to evaluate the bed height, because if your bed is too high, that might also be a problem in the middle of the night. If you have to go to the bathroom, you may stumble out of your bed. It may be hard to get in your bed. So, having a bed that is at an appropriate height is essential. You also want to look in bedside lighting. Again, if we're getting up in the middle of the night, you want to ensure that you have light along the pathway so that you're not falling or tripping on anything. And also, you want to check for clutter. So, removing clutter, cords, rugs, like we talked about earlier, in those spots is also essential. You also want to review your kitchen setup. So, examine the kitchen countertops, cabinets, and appliances for accessibility and safety, minimizing the need to reach or bend. So, my advice is to have all of your things that you usually use in your kitchen on a day to day basis, whether it be your coffee or your certain cups, have them all in one area. That way, you're able to conserve your energy and you're not walking from area to area. Because the more you walk, the more you get fatigued, which is more prone to you falling and slipping or could be more crucial. Okay. So, those are important. And then you also want to review your home entrance. So, thinking about things such as making sure it's clear, well maintenance, and also if you want to have handrails or grab bars there. And also, sometimes people have ramps because sometimes stairs can be quite challenging for some. So, consider that for easy accessibility. So again, in order to prevent those falls, all of you have Sky Fitness memberships and they offer fantastic classes. It's a fantastic gym with many, many different resources. So participating in regular exercise routines is crucial. So, strength training incorporates exercises targeting major muscle groups such as squats, lunges, leg lifts, improve lower body strength and stability. Balance exercises. These can include standing on one leg, heel to toe walking, balancing on a foam pad, and enhancing your coordination to reduce the risk of falls. Also, flexibility exercises. This is also key. Perform stretches from the lower body, including your calves, your hamstrings, your hip flexors, to improve range of motion and prevent stiffness that can contribute to falls. Strengthening your core. Think it's your trunk. So, we do everything with that. It's midline. So, we want to engage in exercises targeting our core muscles, such as planks, bridges, abdominal crunches to improve balance and stability during daily activities. Also, endurance training. Incorporate aerobic exercises like walking or swimming. We have a wonderful pool at Sky Fitness, or cycling into your routine to improve cardiovascular health and endurance, which can help prevent fatigue and maintain mobility. Doing Tai Chi or yoga. Consider participating in this if you haven't done so already. It's a great way to really emphasize those gentle movements, your breath control and mindfulness to improve balance, flexibility, and overall well being. Also, regular practice. Some people don't know this, but you want to aim for at least 30 minutes of moderate intensity exercise on most days of the week. Sometimes it can be hard because we have appointments that we have to get to, or maybe you're volunteering or still have a part-time job. So but incorporating a variety of exercises to address different aspects of physical fitness and fall prevention will ultimately help you down the road. And then lastly, so consulting with a healthcare provider. So before you start any type of exercise, consult with your healthcare provider or PT to ensure that it's safe and appropriate for individuals like yourself to participate in these type of activities. So this is another thing that most individuals don't consider, but having vision checks are important. So having those regular eye exams, you want to schedule those with an optometrist or ophthalmologist to monitor vision changes and detect potential issues early. You also want to update eyewear, so ensure that those prescription glasses or contact lenses are up to date and provide clear vision for activities such as walking, driving, reading, and etc. You also want to address vision problems promptly. So you want to seek prompt treatment for any vision problems such as blurry vision, double vision, or difficulty seeing in low light to prevent falls and accidents. You also, like we talked about earlier, using adequate lighting. So ensure that adequate lighting are in all areas of your home, especially staircases, hallways, bedrooms, bathrooms, to reduce the risk of falling and tripping. Also, avoiding the glare. So, minimize glare from sunlight or artificial lighting by using curtains, blinds, anti glare coatings on windows, light fixtures to prevent visual discomfort and improve safety. And lastly, removing the obstacles. So, what we talked about again, clearing the way. So, we don't want clutter in our way as far as like extra furniture or rugs or cords that may pose as a tripping hazard. We do not want that. So, this is the last slide of our part one series of fall prevention tips. So, thank you all so much for listening. Part two will include medication management, hydration and nutrition, assistive devices, and emergency preparedness. So, thank you all so much. I appreciate your time. And here are my references.